I'd like to introduce our illustrious panel of veterinarians. We have Dr. Richard Markel, Dr. Tim Ober, Dr. Carolyn Weinberg, and Dr. Jan Hein Swagemakers. Hope Markel has assembled for us. At this time, I'll turn the floor over to him.
Thank you. Okay, how am I doing? Can everybody hear me? Okay, great. First of all, thank you all so much for coming. And, as veterinarians, it's really, we love having people know more. The more educated everyone is that we work with, the better we do for the horses. And that's really exciting. And the fact that you're here just shows your interest in it, and we love it and we appreciate it. I'm very, very proud to be with these three other doctors. They're three of some of the top sport horse veterinarians in the world, literally, and that's a pleasure in itself. When we talk about thinking outside the box, it's a little bit of a cliche term now. It was really cool a couple of years ago, and now everybody says, well, you have to think outside the box. And I think that we've been moving towards that in medicine. Now Harvard Medical School and Cedars-Sinai Hospital in Los Angeles have acupuncture departments and alternative and adjunctive therapy departments. And I think that there's some real benefit. We're going to talk about everybody's philosophy later on adjunctive and alternative therapy. And I think that if acupuncture worked so great, then they never would have had to invent corticosteroids or antibiotics. But on the other hand, I think there was a time when we threw out the older treatments in Chinese medicine and just went to Western medicine. And now I think the pendulum's swinging backwards or back to center maybe, and that's really what it's more about. By coming here today, you're kind of saying, well, you know what, I like to think outside of the box, or I'm interested in that, and that's a great thing. This is a little bit too far out of the box. That's Crazy Hair Day, and it's my son. That's probably what he really looks like. But what we want to talk about is that things don't always appear as they are. You look at this plane and, is it a bunch of horses coming for the World Cup, or is it a load of bananas from Costa Rica? And looks exactly the same. When we talk about lameness in a horse, and we're going to talk about lameness in dressage horses, and we think a lot of times that, well, sure, when they're holding their foot up and they have a hoof abscess, yeah, that's an easy one. But that's really not what most of us see in our practice on a regular basis. And when we talk about a horse that's not symmetrical or level, sometimes lameness is kind of like pregnant. You either are or you aren't. You're either lame or you're not. And then we find all these terms that we're more comfortable with. More comfortable is a little bit off, or a tick off, or slightly unlevel. And so it's kind of our job, your job as riders and trainers and professionals, and our job as veterinarians to say, hey, is it mechanical? Did he break his pelvis when he was 6 months old out in the field with his mom, and this is what's left over on the asymmetry? Or is it a painful lameness? And that's mechanical lameness that, is never going to get worse, never going to get better. Is it chronic? Is it neurological? And love the neurological because, I really miss navicular disease. Gosh, any lameness we couldn't figure out, we'd call it navicular, and we were dialed in. We were set. That was a good disease. And then we find out, well, that's hardly any of them ever have navicular disease now that we've got that stupid MRI and all those fancy tools. And neuro's great, though, because when you can't figure it out, you just go, well, it's a little neuro. This is more oftentimes what we deal with when we're looking at the dressage horse. Is it poor performance or not quite an optimal performance? That's really what we're looking for. And also, the sooner you treat things, the more likely they are to get better. The longer things are left untreated, the more likely they're going to be difficult to treat, and your success will be more limited. And or no performance. We have horses that just all of a sudden one day decide, that's it, I'm not going to pee off anymore. Well, it might be that he's just good and sick of his rider. but more likely it's that something's bothering them. Because you and I don't, our back hurts. We don't want to go to work. We don't want to go out and garden and do that. And then there's horses out there that are just such a conundrum. We've all had them that are absolutely international level elite athletes that are lame. And that's always a real miracle. I love this slide because it's really a matter of perspective. Doesn't it look like that horse is so big and that building is so little? Like you could fit 2 of those horses in that whole building, and it's a huge arena. And it really is a perspective on many of these things that we see. And of course, I think the number one issue with performance problems in horses and lameness, number one, is the humane aspect. Again, we don't want to ask these guys to do anything that they don't want to do. So there's a huge humane issue there in performance. Performance is a bit relative because what a second-level dressage horse has to do physically and the injuries and the repetitive nature and the stresses on a second-level horse are very different than on a Grand Prix horse. So we want to try to think outside the box and not crazy, not too far out of the box. So we're going to talk a little bit later. We're going to have, the way this will work is we're going to have a little bit of a talk, then we're going to discuss a few issues, and then we're going to open up to the floor because we really want this to be a very casual, comfortable question and answer so that you get a chance to grill us. Okay, we don't want to go, oh yeah, that was, okay, guys.
Prefers to be front.
Those would be so easy. You can just pull the leg off and glue on a new one. And we're trying to figure that out, how we can do that. Okay, the other, I think, difficulty that we have now with lameness, I'm really proud to be a veterinarian. I think it's such an exciting time to be a veterinarian in equine medicine, and there's been such incredible advances that, 5-6 years ago we'd say the S word, suspensory, and that was the end of their career, and now we're getting 70, 80, 90% of them back into their previous level of work, even at the elite level, and that's just really cool and really exciting about what's coming up in medicine now. The flip side of it is that, it's really important to us. We want you to hear that, remember though, even though we can fix most things, we can't fix everything. And sometimes that's tough. And sometimes we don't fix things, we manage things. And that's also a different perspective than we had several years ago. Maybe he can't be a Grand Prix horse anymore because of a medical limit, but he can be a third-level horse. So we do a lot of that. Things are changing, but the expectations, we may not know the answer, but we're going to try and find it out. Technology, that's a big discussion. And as excited as I am about the technology and where digital imaging has taken us, where MRI has taken us, digital ultrasound, digital radiography, it's fantastic. But, really, it shot us to a new level of accuracy, but it can also shoot you to outer space. And I put down there Midge's famous quote about nuclear scintigraphy. Dr. Midge Leach, who's at New Bolton Center in Pennsylvania, she's been the dressage team vet for many years in the past. And I remember one day we were at dinner and she says, that nuclear scintigraphy, she said, what a disappointment. I'm going to really water down what Midge's language was because we're in a group here. And she said, I thought I'd never have to bend over a horse again and get kicked in the face, because I'd have this machine that would tell me where the horses are lame. And it just didn't work out that way. And that's really true. The technology is just things that help us. They're additional tools. This is just a Grand Prix jumper that, this is a bone scan here, and there's a hot spot on a coffin bone. There's an abnormality in the horse's neck, and he was not lame from either one of those. So that's where you have to be careful that, your technology, and I have a slide later that says, you ride the horse, not the radiographs. And that's really important. So we use all these things, and everybody here on the panel is very technology, I don't want to use the word dependent, but we use it as a tool, but maybe that's the point, is that we're not technology dependent, and it's really careful. We have to be careful that we want to get a rope around it, but you can also grab the wrong thing. And I love the toys, but you really have to use them appropriately. I mean, you ever notice MapQuest? When you get directions, sometimes they're either wrong, or did you ever notice that it takes you by every McDonald's and Starbucks in the town? And that's because of a little bit of corporate sponsorship. That isn't an accident. So here you go. Remember that you ride the horse, not the radiographs. The other thing is we have to be careful of an overdiagnosis. My son made a correct diagnosis. That was stinky, smelly French cheese. And it could be as bad as it smells and taste as bad as it smells. But we have to be careful, because I think the other thing is that with everybody's expectations of coming up with an answer, a lot of times veterinarians feel pressured to come up with an answer and to find something, or therapists are going to find something. You know, rarely do you see, hey, I love it when I have a chiropractor work on one of my horses and says, you know, this horse is really balanced and everything's good and I didn't need to do anything. Boy, that's a therapist that I really trust. And it doesn't happen very often, but that is really good. And I think the importance of an accurate diagnosis, it is the cornerstone to an effective treatment, because if you don't know what you have, how do you know how to treat it? So you got to figure out what it is and then make a plan. And there sure may be a lot of different ideas on how to treat things. If there wasn't, there'd only be one way to do everything. And that's not the way it is in medicine, as we all know. We're going to talk later in the panel about adjunctive or ancillary treatment. And, you know, chiropractic manipulation is a treatment. Now, we have some members on the panel that are going to discuss on how they use it to help them diagnose cases. And I think that's really interesting and very valid. Same thing with acupuncture. The farrier, I can't fix a horse, period, without a good farrier. That's how important they are. And I tell people, I hate to admit this, but your farrier is more important than your veterinarian. Is that okay? Am I going to get stuff thrown at me? But I really believe that, because they're the basis of getting these horses better and performing right, even if they're not perfect. I think I missed one there. Oh, and the internet. Yeah, you know, internet's been a real mixed blessing, because it's wonderful to be able to look things up, but you have to be a careful consumer, because there is as much misinformation as there is good information. And the veterinarian needs to be, Dr. Ober said earlier, a gatekeeper, and we're going to talk about that a little bit more. I like this one because, you know, you can't totally trust a man's opinion if his livelihood depends upon it. And, you know, we get probably anywhere 10, 15, sometimes if it's a good week, 20 new miracle cure flyers across our desk. And if you feed your horse this, he's going to stop limping and it's going to cure his cancer and he's going to live till 90 and he'll be able to swim the English Channel. And, you know, it's just, oh my gosh. And you have to be really cautious about that, because I think it's a bit unfair, because they're playing on our desire to help our horses for sure. And that's why we buy all this stuff. But it's pretty remarkable, some of the feed rooms that I'll go into, and these horses will be on 35 different things. When we look at performance in horses, per se, lameness per se, we have to look at it, is it primary or secondary? Is it adaptive stress changes? You know, I look at a horse like a cheap card table, and when one of the legs is wobbly, the whole table wobbles. And so when the whole table's wobbling, they don't get level and balance until we get the matchbooks under the right leg. And if you put it under the wrong leg, it wobbles worse. And that's really important, because so many of the injuries we see, well over 50% of all the lamenesses that we see are multiple sites or compensatory lamenesses, and it's kind of our job to figure out what's 1, 2, and 3, if we can, or sometimes we just have to treat all of them. I put down here is figuring out if it's your spouse's horse, because you might as well give up, you're never going to fix it. You can't, if it's your wife's horse, you're never going to fix it. And it's okay to be wrong as a veterinarian, but it's not okay to stay wrong. And so it's an art. And sometimes we'll use therapeutic treatments as diagnostics. Well, let's try this. And if it works, then you were a genius. If it doesn't work, it didn't help you and you got to try something else. We want to look at lameness and movement from as many angles as we can, and look at it from different perspectives if we can, and look at the whole horse. That's the old holistic thinking, because a horse isn't going to be right without the rider, the farrier, and a sense of balance of the whole thing.